Welcome to Facebook Live. I'm Vivian Greencorner. I'm a dementia care specialist in private practice. In my work, I address my clients' care concerns, helping them to devise a personalized care plan which provides solutions. I coordinate and connect caregivers to needed services with vetted agencies, community-based programs, and professionals. My local practice is in northern New Jersey, and I also work with long-distance caregivers. I end up sort of being the boots on the ground. Dr. Sherzoy and I want to talk to you today about why it's important to maintain good dental health for individuals with dementia and how to prevent the development of dental problems, complications, emergencies, and to minimize the risk of unnecessary tooth extractions. Why is this topic important? Alzheimer's and related forms of dementia are on the rise. By age 65, 10% of the population has a diagnosed form of dementia, and that number jumps by age 80 to 30%, meaning close to 1 out of 3 individuals by age 80 have a diagnosed form of dementia. When an individual does have dementia, it's a neurological degenerative brain disease. It negatively affects a person's memory, their thinking, their functioning, and their behavior. How does dementia, though, stop an individual from maintaining proper dental health? As I mentioned, there are problems with memory. And for example, a person might not remember, did they brush their teeth today? Did they brush their teeth yesterday? And due to the cognitive impairment, they lost their ability to follow steps. So for an example, a person can take their toothbrush out and forget to put the toothpaste on and just start brushing their teeth. Or they can put the toothpaste on and then forget to rinse and spit out, and then they just swallow the toothpaste. Also, as part of this brain disease, often people with dementia lose their sense of smell and discomfort. So they won't have a sense of bad breath, and they won't have a sense that pain that they might be experiencing is in their mouth. In addition to loss of indicators of poor dental hygiene, when caregivers have to take care of an individual with dementia, they have a very full load of responsibilities in terms of personal care and activities of daily living. So unfortunately, the whole arena of personal hygiene ends up being low on the totem pole. And they give themselves excuses of, well, I helped them brush their teeth this morning. I'll do it again tomorrow. I don't have to do it tonight. It's been a very long day. Or, you know what, they brushed their teeth yesterday. I don't have to do it today. I want to, though, state that it's very important, as part again of this brain disease, that individuals who do have dementia often lose the ability to verbally report pain, and that includes pain in their mouth. So rather than telling you that they have discomfort in their mouth, they might instead express it in behavioral ways. They might become disinterested in eating. They might start pulling on their mouth or their teeth or grind their teeth. They might become more aggressive or more withdrawn. Again, they won't be good reporters of pain, but they're going to call what I'll call act out. So caregivers need to look at changes of behavior and changes in mood. I'll now turn this discussion over to Dr. Sherzoy, our dental expert, who will discuss the accommodations and recommendations she has to offer successful treatment to individuals with dementia.
Hello, everyone. Thank you, Vivian, for introducing me. And again, as Vivian mentioned, I'm Dr. Sherzoy. I've been in practice in Inglewood over 30 years. I graduated from Georgetown Dental School in 1990. And over years, I have been got extra certification on Invisalign, which is straightening the teeth without braces, and root canal through NYU University. And also, I have taken so many classes and went to so many abroad countries to do implants. So I have certification in implants. And to do all this is in order to provide better service for my community. I take care of children, adult, and elderly, and I'm dedicated to elderly patients who have dementia, and I'm seeing patients already with Alzheimer. And my office is completely um, easy and friendly for patients who um, have, they need to use wheelchair and they need walker because it's at street level. So we don't have steps. So that is another advantage for them. Why do we need proper oral hygiene in elderly adults, and why? What are the consequences of bad oral hygiene or poor oral hygiene? The poor oral hygiene causes COPD, which is chronic obstructive pulmonary disease, gum disease, which causes loss of the gum and eventually loss of teeth, diabetes, because once it's a lot of bacteria, this causes increase in insulin and sugar in the body, which increases the diabetes, which is also it causes inflammation. It's like a cycle, inflammation and gum disease more, and it increases the dementia when oral hygiene is poor. And causes dementia and Alzheimer, because in recent years they have found the same bacteria which is in the mouth, they have found it also in the brain, and or the causing the ill-fitting denture, where we by missing teeth, we lose bone, so the denture just starts fit not properly, and it causes stomatitis, which is inflammation in the mouth, and soreness and all over by the lip, by the gum, or by under the tongue. So all that can be caused. All how to accomplish a good oral hygiene in our elderly, as Vivian mentioned, it is very difficult for them to remember, when they brushed, when they rinsed their mouth, or when they even ate food. So at this stage, we highly depend on caretakers or a family member who lives with our elderly. And the proper oral hygiene, I highly recommend brushing at least 3 times a day, in the morning, middle of the day if possible, and at night. And there are so many tools available to make this easy, like Braun or Philip Sonicare, rinses like Listerine or chlorhexidine, which can be prescribed by their doctor, dentist. And the caretaker must make sure that our elderlies who have dementia or Alzheimer, they must see their dentist at least 2 to 3 times a year. And at the end, they must make sure the elderlies eat healthy food. Healthy food, encourages the healthy body and healthy mind. Of course, we all know that. And also avoiding carbohydrates, because carbohydrates increases the bacteria in the mouth. So, all this said, my office is my staff. We are very friendly, kind, and we care for our patients, and especially elderlies. When they come into my office, they are completely in a in a new territory, so they're totally lost when they come in. So we are very important, crucial moment is that how we behave with them, how we come across with them. So in my office, we go to the front, I hold their hands, I talk about their families, about their life, just to make sure that they are comfortable so they're not scared and they feel comfortable. Once they are feeling comfortable, then I take them to my operatories, take care of their oral care, whatever is necessary. So here, and if they need any particular music they like, we put that music for them. And I encourage the caretaker, which is either the caretaker or family member, to be in the room with them so they are comfortable. They are not able to tell us, as Vivian mentioned before, they don't tell us that, where it's hurting, or where if they have halitosis, which is bad oral, bad odor. And all this they cannot tell. They cannot tell if the teeth are loose, or so it is our job is to see, if there is any inflammation, any mobility, any cavity here. When once they are comfortable, we work together with them to make it sure that, make it easy for them to, so they are able to take care of their mouth with my help, with the oral, the caretaker's help. So our mission is to provide the best care that is possible for them and make it easy so they are not afraid. Again, I appreciate your listening to me, and I'm always available. And my phone number, and it also sometimes comes to my cell phone. If in case you need anything, please call me. Thank you, and thank you, Vivian. And
Thank you. It's so important, as you said, it's really the approach and being sensitive to engage an individual with dementia, as you say, so they're comfortable, involve the family member, because there's the ones that are going to have to be able to do the follow-up with the individual, because as I said, that person with dementia is not going to remember why they were there shortly after they leave your office. And accommodating to that person with dementia is so critical. So thank you. Somebody who specializes in working with individuals with dementia is really what family members need to be looking for, and asking those questions as you've highlighted today. So thank you very much. And if you need to reach Dr. Sherzoy or myself, our information is in the summary for you. Thanks again, everybody.
thank you, everybody.